The adenovirus has killed at least 11 children in New Jersey since September. And most recently, a college freshman at the University of Maryland. Dozens more cases have been confirmed, with 2 more identified in New Jersey on Friday. Emergency room physician Dr. Robert Gatter from Lenox Hill Hospital joins us now from New York City with the latest. So, Dr. Gatter, how is the virus spreading, and has it been contained to just a few locations?
Well, at this point, we don't know exactly if other areas will be affected, but we do know the area in New Jersey, and we also know about the student at the University of Maryland. The virus is in our environment. It's spread by contact, and that means that when you cough or sneeze, you can easily transmit it. And also the particles, if they're on a surface, they can easily be picked up. That is, if you touch it, or if you then touch those particles and then touch your face, in terms of your eyes, your nose, or your mouth, and then you could actually get the virus that way. And the virus is very hardy. We know that it lives for about a month on surfaces, hard surfaces. And because of that, cleaning it and trying to disinfect it is problematic. Standard cleaners or disinfectants don't typically work, and therefore you need industrial strength cleansers and detergents.
What makes this virus particularly deadly in children?
Well, there are different subtypes in certain cases. The adenovirus has over 50 different types, but it's the type 4 and type 7 that is the most deadly. Type 7 is the type that we saw recently in the New Jersey outbreak. And the children are in very close quarters, and because of that and how it's spread by droplets, by aerosols, when you cough and sneeze, it can be easily transmitted. The type 7 adenovirus seems to cause pneumonia, and the type of pneumonia it causes is what we call necrotizing, and because of that, it's deadly. That means that, in other words, the virus affects the tissue in such a way that you can't oxygenate it, and because of that, therefore, you have hypoxia or low oxygen concentration. And that's serious, because if a child can't breathe and can't get enough oxygen into the brain and their body systemic organs, then it's an issue.
Boy, that sounds absolutely devastating to hear you say that. What are authorities doing to combat the outbreak at this point?
Well, at this point, we're trying to have, good public health measures. Washing your hands, certainly if you use the restroom, because the virus can be shed in stool. And also, if you're amongst other people, you can't share towels, utensils, cups, obviously avoiding close contact, which includes kissing and hugging. And it sounds drastic, but these are measures that are important to implement in the setting of any kind of public health emergency.
And are the efforts at this point showing success, or is the risk still pretty high?
Well, we don't know actually at this point, but we're hoping that there are no additional cases that emerge. But then again, we don't have any clear indicator. The virus is in the environment. It's hardy. It's hard to kill. And again, keeping your hands clean, washing your hands, being cognizant of your behaviors around others, and practicing good hygiene is probably one of the most important things you could do to help prevent the virus from spreading.
It's just so incredible to hear you say just how hardy this virus is, that you need industrial strength cleaning products to really be able to deal with this. If you suspect that your child might be infected, what should you do?
Well, you first of all should speak with your physician, your pediatrician, but if there are signs of respiratory difficulty, if the child can't breathe properly, if they're vomiting, can't eat and drink properly, they need to go to the hospital. They need to go to the emergency department for immediate care. And that includes IV fluids, checking blood work, to check what their white blood count is, because these are all important indicators of the severity of disease.
Dr. Robert Gatter, thank you very much for joining us, Doctor.
My pleasure.